I'm just going to show you a little bit around our ward, and as you can see, this is the pediatric ward. What you're seeing in front of you here is what I call standing room only, so we have too many patients for beds, and the ward is essentially divided into two. We've got what we call the medical side here, which is any child who is not severely malnourished is on this area here. This has got about 15 beds and a few cribs as well, and these children are really extremely sick. So they will come in with conditions like malaria, pneumonia, they'll come with diarrheal illnesses, some of them come with burns and various injuries. And this particular area here is generally where we keep our neonates, so these are some of the most unwell, tiny babies here. There's a little baby here weighing just 1.3 kilograms, actually under phototherapy for severe jaundice. So baby's doing a little bit better, starting to tolerate some feeds, but still not out of the woods yet. And we really are chronically under-resourced here. It's a huge challenge to manage this volume of children